Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, it's Di McQueen, and welcome back to Healing Families Shattered by Addiction. Today I was going to talk to you a little bit about maybe some additional tools and coping mechanisms that will be helpful in understanding how we as family members support the person or help us get support for ourselves in recovery. Okay, so when you think about it, addiction affects everybody, right? People believe that it just affects the addict themselves, but we know as family and friends of a person struggling with substances, it's very, very difficult. There's lots of misinformation out there. There's lots of labeling, going on. Sometimes, you're told when you really know that you haven't been, that you've been neglectful, that you're abusive, and maybe you have enabled in some fashion. Or maybe you're just feeling uncomfortable because, as you get further, family members get further and further into their addiction, we as family members tend to isolate. We know that it has all kinds of psychological burdens. We get into financial ruin, emotional ruin, everything else, right? And when I start to understand, and help people understand the role that the family member is playing in all of this, the most important thing that I discover a lot of times that there's so much, that people believe that they're alone, that nobody really gets them. They're not educated. They, have this conviction, and a lot of people out there do, which this is some sort of moral failing. Brian and I absolutely believe without a shadow of a doubt that it follows the disease model, and that has, yes, sometimes it starts off with, I'm just trying to have some fun and get rid of my problem statement or whatever. But when you are addicted, I've rarely found an addict that really enjoys where they are by the time they come to see someone like me. There's a tremendous amount of social prejudice, labeling, blame, you know, self prejudice, and we avoid treatment as well. It's like the plague. Nobody can talk about this deep, dark secret that's going on. And, I'm going to challenge you to bring it into the light and understand that most people, when they find out that there's help available and that there's people that can understand them and that they're not alone in this journey and that there's lots of tools and techniques that can be supportive and help them understand the whole encapsulation of what addiction looks like, but also the part that they're playing in it. And each of us does. I certainly know in my own personal journey that I definitely played a part in, my addicts or the addicts in my world's lives in maybe continuing what was going on, maybe not really understanding the best way to handle or provide for them, to be supportive. Um, at times I would get frustrated and, just get exasperated. You also get financially ruined if you allow yourself, but mentally it tears you down. And so there are things that we can do. We have to get educated. First and foremost, most people don't really understand what's going on in the brain of an addict and how it is changing based on what drug of choice or what it is that they're doing to their body and how that manifests itself. A lot of people really believe that this disorder stems from being weak, willful, or stubborn, when in fact, this is not a moral failing. It's not a sign of weakness. If anybody, could talk to an addict, if they could, they would, right? A lot of times it's not about not being willing. It's about a physical addiction at times where we've gone that far with it. Um, but it certainly isn't easy to live or support someone who has an addiction. It's really, really hard, very, very stressful, especially when it's persisting for years and years and years and it just wears you down. So I think the thing to understand is, if I'm able to connect with peers and people through other programs, get some help and not be, ashamed of the fact that this is going on in my world, this beautiful thing begins to occur. Um, the family member gets to find, better quality of life. They have problems with the addicted person because they're learning tools and techniques, when to shut their mouth, when to open their mouth, when to set a boundary, when not, when to stay away, when to enter. It lowers the level of stress that they have and certainly improves their psychological health. I think that that's the one that most people don't really understand, that you get worn down. You don't realize all of a sudden you go like, why am I so depressed all the time, or I'm so anxious? And I never used to be like that. And in fact, there's a reason, that you are worn out. We feel isolated, that nobody really wants to talk about this thing. You want to fade into the dark and just kind of be done with it. And I don't want to go out. I can remember not wanting to go out, not wanting to talk to anybody, just kind of like, well, I'd go sit in places that were very quiet just to kind of recharge myself. I'd go hiking, me and the dog. And before you know it, I had friends saying to me, like, hey, we haven't seen you in months. Like, what's going on? So it's really important that you start to find, tools and techniques. So today I'm really just going to focus on, giving you a list of support groups and ways in which you can reach out and be able to be part of a world that understands. And I think that's really important. Like I said, you're not an alien, you are not terminally unique. This happens a lot more than we think. And in today's world, even more so. I think statistically, we know that, when there's an addict involved, it touches about 8 people. So it affects, 8 people around you in a positive way or negative way. And that's a lot of people, right? A lot of people. About, you know, millions and millions of people are affected by addiction each year. And therefore, we know that that means tens of millions of people that are family members are also affected, and they need support. They need support networks. Of course, the first and foremost, I'm always going to tell you, is reach out to a counselor, someone who understands addiction. But in addition to that, they can help you through the day to day, you know, real minutia of, what you need for you and helping you, but needing the support and getting friends and, other people that understand what's going on. And so that you start to recognize there, people have suggestions, they're supportive, they've been down the road, you can see hope. All of those things are so important. So the first suggestion I make is an Al-Anon group. That's the worldwide support group for family members and friends of those who are addicted to alcohol. Um, and now people do go who have, members of their family that are addicted to drugs, etc. There's also Nar-Anon, which is for narcotics. Same kind of thing. It's a worldwide fellowship, which is a support group for those members who have, narcotic issues. Either or, both, doesn't matter. We go. That's the most important thing. Yes, there are some slight differences between the two and how people operate, but whatever you seem to connect with is the most important part of this. Then there's Alateen, which is the division of Al-Anon that's specifically designed for adolescent family members of alcoholics. So that's for the kids, 7 to 17, the age. And there's, people that are that have been you have to go through a screening process to become quote unquote a counselor. It's not really a counselor, it's people running the meetings, but they are screened, so there are viable people that are involved with the children. But it's also to have children that have like minds with other children that have had to deal with this situation for years potentially, and how it affects them, and having someone their own age and their own peer support is really, really crucial. um, and it's a wonderful organization. Families Anonymous is a group for relatives and friends concerned about the use of drugs or related behavioral problems. GRASP, which is GRASP, Grief Recovery After Substance Passing, is a support group for people who have lost a loved one due to substance abuse. And obviously that sets up its own set of grief, right? Everybody, I think, that is involved with someone who has addiction is going to grieve in some way the loss of that child, the loss of, what the person might have been, could have been, even just the way that the child has gone, or their marriage or whatever. So there's grief, but this is a different kind of grief. This is after an actual death of a loved one. NAMI, right, which is the National Alliance on Mental Illness, provides a wide range of support options for loved ones of people suffering from symptoms of mental health conditions, of which oftentimes most addicts or alcoholics are, there's a secondary, right? They're dual diagnostic, and they're depressed, there's anxiety, there's bipolar, there's schizophrenia, and a lot of people are just trying to put out their own fire and self-medicate. So a lot of times if we can get the underlying mental health condition addressed, they are able to put the substances down. So I think that's a really important one, where people don't really understand that sometimes you have to understand, as the person, have a dual diagnostic situation going on. And there's many other things, there's personality disorders, there's, trauma situations. And yes, high statistics in those using and abusing that have gone through some traumatic experience, whether it's abuse, whether it's a one-off, there's a rape, there is a kidnapping, there's, a breaking and entering, some form of trauma that occurred, and the person was not able to cope in a way or get the help that they needed, and they found a way out by numbing themselves. Very important that people address those issues. PAL, Parents of Addicted Loved Ones. That's a Christian-based program for parents who help other parents learn how to cope with an addicted child. And that allows for both educational and peer sharing opportunities. There's also Celebrate Recovery, which is actually, for people of all kinds of addiction. So sometimes family members show up at that as well. And lastly, I'm going to give you one other, which is Smart Recovery for Families and Friends. And that's a group that's alternative to Al-Anon, that focuses more on science-based and non-confrontational methods of helping your loved ones. There's many more. There's many, many more. But this is just a short version of some where I think that, you could get some immediate help. It's a buck in a basket. It's not expensive. You can quickly get some people who understand that you yourself are not alone. It's really, really key to our recovery to start to understand strategies and having to learn ways to deal with this situation that none of us really dreamed we're going to be on. But you are not, an alien. You are not, a social failure. You are not any of those things that you might be perceiving yourself as, or that oftentimes our society contends with. I wonder what happened inside that family to get this person to do that. Sometimes there are things for sure, but there's lots of times when there's not things. Maybe the kids just got caught up in, being with their peers and wanting to be cool, and unfortunately they end up in a situation. Maybe some terrible tragedy has occurred and a trauma ensued, and the child or the person, the adult, was not able to express it to anybody, and somehow came up with this great idea of how to fix this problem that turned out to be not so great. So there's wonderful ways that we can kind of learn how to quickly help people. And then, of course, like I said, getting some strategic strategies and some real understanding from a counselor on a one-on-one, where a little different than what you can give in a group setting. It is a little bit more personal and a little bit more where you can elaborate and you can kind of find strategies. But my suggestion would be to make sure that you get a counselor that really understands addiction and how to deal with families. Of course, those are all like 12-step types of programs, etc. And those are wonderful, where they have different modalities and different modules that you can kind of get through. There's also, these, of course, have had a lot of pre and post outcome measurements. And so there's a lot of, evidence-based information on that. There's other things called strategic family therapy, BSFT, was compared to treatments in a lot of these different settings for adolescent substance use and parents' alcohol. That's a helpful strategy too, where people can get some demonstration in how their parents engaged in this, what behaviors came out of it, what do we need to do that can help them get through this in a different fashion, and how the information about the way their family's behaviors influence them. So there's also adult children stuff where we can get into all kinds of other programs, but there's CRAFT, community reinforcement approach and family training, developed to treat alcohol use disorders, and now implemented to treat addiction to different substances, engaging the family to help get the family involved, so that there is something that everybody can do within the community to help look at this as a whole picture. Again, finding out that families are such a big, big part of the recovery, and they can be the most positive influence and support for the person that is suffering from addiction, or they can be a detriment to that person and themselves. I think it's really, 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 really important that people understand that. So just a quick one today to just give you some really quick peer support groups that you might be able to look into and, strategize with, so that you can get some stronger understanding on how you are not alone in this journey, and that it's a really important one that you recognize we all need help. We all need support. You are not to do this alone. It doesn't usually work when we're stuck in our own way of thinking and in our own heads. Guess what? We get the same outcome over and over and over again. It's important to understand and to learn that you are part of the solution, or you can be part of the problem. All right? We hope that you're part of the solution. And I hope this was helpful in a very short way of telling you about peer support. We still have information on our website that you are welcome to have for free. It's a free resource pages where there's lots of information on different strategies and things to help. You can always reach out and email us at info@familyandaddictionexperts.com. We're always here for you, and we'd love to hear from you and answer any questions we can. Okay, until the next time, this is Healing Families Shattered by Addiction, and I hope that you have a great rest of your day. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.